And former CDC chiefs from both Republican and Democratic administrations are sounding the alarm on RFK Jr. They blasted him in a New York Times op-ed for endangering every American's health after he fired former CDC Director Susan Minares. Now, she had refused to fire other leaders at the agency who backed the efficacy of the COVID-19 vaccines. President Trump, in a Truth Social post, is demanding Trump companies justify the success of their COVID drugs, and now says the agency is being ripped apart over the fight. Here's how Health and Human Services Secretary RFK Jr. sees it.
The CDC is an agency that is very troubled for a very long time, and anybody who lived through the COVID pandemic and saw all of these bizarre recommendations that were not science-based.
The group chat is back. I'm bringing it to you guys because it's not every day you have a collection of former chiefs of things coming together these days to say, look, this actually could have consequences and cause danger. Maria, what do you see in this moment of them willing to speak publicly?
I think it's a moment that crystallizes what so many people were concerned about when Trump nominated RFK Jr. for this position. And I think the one person that is going to have some regrets here is Senator Bill Cassidy, because he was the deciding vote, as we remember, Republican senator, doctor. And I am sure that going into that vote, he wanted to perhaps vote no for all the reasons we know, right? This is not Republican versus Democrat. This is science versus crazy.
I'm not sure how much of a difference it would have made if you think about why some of these CDC people are leaving, which is like they were being asked to fire other people, right? If you go through this personnel as policy type position. One of the things that the CDC's director, Dr. Richard Besser, described, he's a former CDC chief, is he says, we now have an acting, actually we have him. Let's see if we can play it.
We now have an acting secretary, an acting head of the CDC who has absolutely no experience with the agency or in public health response. So, I really worry what the consequences will be if we have a public health crisis in the near future.
Okay, we also have a NASA chief who's not a rocket scientist. Yeah. So help me understand how bad this one is.
So look, there's a timeline in which I would be on this show supporting a Republican administration for major shakeups at the CDC and NIH, because I think these bureaucracies needed major shakeups for all sorts of reasons. At the same time, I've been saying that Robert F. Kennedy Jr. is a crackpot crank for 25 years, when he was a darling of the sort of fringe left, and now he's a darling of the not even fringe right. And it's beyond vandalism what he is trying to do, because I think he is bought into crackpottery at a very high level. And the problem is that that Donald Trump feels like he owes RFK in ways he doesn't owe other cabinet secretaries.
Yes, he brought in that Maha wing.
Right.
And
it was one of the only times in the campaign that Trump's numbers actually went up, is when RFK endorsed. And that's, I think, the background of that Truth Social post, is that Trump does not like this.
Right.
And it's very rare I agree with Truth Social posts, because they're basically wacky Japanese game show weirdness. But by all means, if Pfizer has data that would clarify the fact that the COVID vaccine is safe, release that data.
Isn't part of the conspiracy, when we use this term conspiracy as news people, it's not just a slur, it's the idea that no amount of data would actually convince a person. Right. But I want to bring something up about the consequence of this. Here's how the Trump administration is responding. They're saying, although the world has moved on to a risk-tiered approach, some in the American medical establishment are maintaining their blind faith in a strategy of boosters for all in perpetuity. I want to translate a little bit. It's like we should take more risk as Americans with our health, that's acceptable and other places do it. And we don't have faith in what the medical establishment has been saying about these drugs.
Yeah, and look, it is a measure of how broken we are still from the pandemic, that 4 or 5 years after we were all locked indoors and worrying about dying from this disease, we're going through whether there even should be a functional Center for Disease Control. That said, RFK Jr. is not a scientist. He's not a doctor. He is not making these decisions based on science or fact. He's making it based on his own hunches about how things work. He had a comment last week about how he would walk through airports and see that people had mitochondrial deficiency. What is he talking about? And what we're seeing here with the CDC is that the people there who have left are saying, I don't know who's briefing him, but it's not us.
They were saying
right?
no one's briefing him. Actually, we saw
terrifying.
that earlier
I think that's the thing. I think we've gone past the moment of just shaking our head. This is downright dangerous. People are going to die, and I thank goodness that my children are now adults. That I don't have to depend on what is coming out of the CDC for the vaccine.
Mine are not, and so I care about that child immunization
exactly.
table.
Well, that's
I'm
what
in
I
an
mean.
internal panic.
That's
okay.
right.